Hey guys, it's Dr. Blackett here with Yada Yada Health. Today we are talking about Plan C, the dreaded C-section. That's what I call it anyway, is Plan C. That's pretty much when you're in labor, we all hope for a vaginal delivery, right? But sometimes other things happen and we have to go with Plan C. And I'll tell you, I'm always grateful to be in a place where at least we have options like this to get a healthy baby here, because that's the goal, right? Ultimately, we want a healthy baby. Remember, I brought with me the most common questions that I get asked about C-sections from my patients, and I'm delivering those to you. What are the reasons I might have to have a C-section? Well, we always talk about the 3 P's, which means the power, the pelvis, and the passenger. So in labor, the power indicates your contractions. You might have to have a C-section if there's a problem with your contractions and your contractions are not strong enough to move the baby through your pelvis. The pelvis, that's pretty straightforward. Sometimes, well, let's face it, all the time, we can't really choose what the shape of our pelvis is. We get what we get, and some of us do not have a pelvis that is particularly great for birthing babies. We'll know that usually because you'll either stop dilating during labor or the baby will stop descending in your pelvis. Then we know that there's basically just a fit issue. And the 3rd P we talked about is the passenger. And that little passenger, although they're very cute and we can't really blame them, sometimes they're at fault. And that might be because of their size. Maybe the baby is just too big to fit through your pelvis. Maybe the baby is coming down in a way that is not conducive to a vaginal delivery, such as breech or with an arm or something else presenting. So those are the 3 P's. There may also be other reasons for a C-section, such as stress. If the baby's in any kind of distress and you're not close to an imminent delivery, then that may need to be done via C-section. Will I feel anything during my C-section? Let's face it, that is a pretty important question. And a question that always doesn't have a straightforward answer. You'll usually have, depending on the reason for the C-section and what the circumstances are, either a spinal block or an epidural. And that will be dosed so that you shouldn't feel anything that's sharp, but you can sometimes feel some pressure, some tugging, or some pulling. We always test you before we start with the C-section to make sure that you're not feeling anything sharp. If for some reason you are, then the anesthesiologist will either give you some stronger medicine or might even talk to you about going to sleep for the C-section so that you don't feel anything. But generally, we do just fine with either an epidural or a spinal block. If you have any questions about that, you can watch one of our other Yada Yada Health videos from one of our anesthesiologists. What happens during a C-section? Well, the first thing we need to do is to get down to the baby. So we make an incision that's generally about like this, depending on the size of your baby. And we have to go through several layers and separate those. We don't usually cut your muscles. That's important to know because I've had a lot of patients who were under the understanding that their muscles were cut during their C-sections and that was going to affect their ability to exercise or whatnot down the road. But in a typical C-section, we don't cut your muscles, we just separate them in the midline. And then we get down to the uterus and make a small incision on the lower part of your uterus to bring the baby through. Once the baby is out, the nose and mouth are sectioned, and we cut the cord and hand the baby off, usually to the nursery staff, if possible, giving you a quick glimpse before they're handed off. And then we work on delivering the placenta and getting all those layers back together. If it's your first C-section, we can usually get down to the baby pretty quickly. It may only take 5 minutes, or if it's an emergency, even less. Getting everything back together afterward may take 20 to 30 minutes, but all in all, you're looking at about an hour long. Not too bad, considering sometimes how long labor can be. How soon can I hold my baby after a C-section? Well, this will depend on how your baby's doing. If the C-section was done for any kind of distress and the baby needs any help with breathing, then it may be a while before you can hold your baby. If it was just a routine C-section or a C-section for a fit issue, then after we know that the baby is fine, then they can often come over and even start maybe doing a little bit of skin to skin with you, depending on how you feel, and as long as you're comfortable with that. What will my recovery be like after a C-section? This is the major difference between a C-section and a vaginal delivery. With a vaginal delivery, you're usually up and moving around pretty soon, but with a C-section, you may feel like you've been hit by a truck for at least a few days. Get plenty of rest. I know this from personal experience because I did have to have one C-section. I took it easy for a few weeks. After that, I didn't even feel like I had surgery. So it's really not too terrible in the long run, but you'll really want to listen to your body. You want to find a balance between not being just a slug in bed and being up and walking around, but not doing too much that you're feeling a lot of pain. So find that balance with yourself, get plenty of rest, drink lots of fluids, and you'll be feeling better in no time. The first few days, you may have a little difficulty standing straight because of that incision. You'll feel like a 90-year-old woman pushing your baby down the hall of the hospital. You'll be hunched over. But every day, you'll feel like you can get a little more and more upright. And like I said, you'll be back to normal in no time. Will having a C-section affect my milk coming in? Having a C-section should not affect your milk coming in. Your body will still release those same hormones that get that going and send that message. So you don't need to worry about any of that. Can I have a VBAC? So a VBAC is an abbreviation that stands for a vaginal birth after C-section. You can have a VBAC depending on the circumstances that your C-section was carried out. If you had a C-section for an issue like a fit problem, or your pelvis, or the baby being big, all those things might possibly happen again with another pregnancy. So you could always talk to your doctor about it. You can try to have a VBAC, but there's a very good chance that if you had your initial C-section for one of those reasons, that you'll be back having a C-section again for those same reasons. If you had a C-section for something like fetal distress, or let's say your baby was breech, then that may be completely different this next time around, and you can always give it a shot and see how it goes. There are some risks associated with VBAC, and I'll have a video about that. So if you have any questions, visit that, and hopefully we'll get everything answered for you. How many C-sections can I have? This is another one that you won't get a straight answer to because it really depends on the individual. Everyone heals differently. I've gotten in on some what we call repeat C-sections where patients have had a C-section before and their scarring has looked really good. Every time we do a C-section, we want to assess that scar tissue and we want to assess the uterus and how thin it is to make sure that it is safe to have another C-section. Your doctor will usually tell you after every C-section if it's okay to proceed with another one. On average, we usually have patients going maybe 3 or 4, maybe even 5, but again, that'll really depend on your body. That's it for C-sections, guys. I'll see you next time.